September is Cardiac Disease Awareness Month. And before we get into prevention, symptoms, treatments, I'd like to introduce two amazing women. You have no idea the awe in which I am in right now. I was like, how does one become a cardiologist? Yawa, my heart is broken. Can you heal my broken heart? No, but that's another matter altogether. Dr. Naomi Gashara, Dr. Karimi Nguchu, welcome to SpiceFM.
Thank you.
Thank you.
Dr. Ari, please introduce yourself.
Good morning, all viewers. My name is Dr. Naomi Gashara. I'm a pediatric cardiologist working at Kenyatta National Hospital and all other major hospitals in Nairobi. And I deal with children with heart diseases, mainly those who have been born with diseases and those who acquired it, having been born with normal hearts.
I'm Dr. Nguchu, and it's a pleasure to be here. I'm an adult cardiologist based at Kenyatta National Hospital, Othaya, and also in other private hospitals in Nairobi. And I mainly see adults who actually have heart diseases, and also the children whom after Dr. Gashara has seen, and they grow up, now they come for follow-up with me.
I'm so interested in understanding, how does one become a cardiologist? Was it something you were 14, 15 years old and just thought, you know what I'm going to do? I'm going to become a heart specialist. Like, just walk me through that, please, Dr. Nguchu.
Actually, I always had an interest in sciences throughout my schooling, but my initial interest had actually been more in physics, so I wanted to be a nuclear physicist.
Let me tell you, as someone has met a Nobel-winning nuclear physicist, you're better off as a cardiologist. No, I also love physics, but astrophysics. Go back to cardiology, please. So when did that passion arise?
Well, there was no opportunity to actually do nuclear physics, so I went into medical school. And
Yes.
that is where I actually met Dr. Gashara and Dr. Joey.
Yes.
And they sort of inspired me. And after that, it was just the various places I worked, I had the opportunity to see a lot of cardiology patients.
Yes.
And that's how it basically grew. So throughout my journey, it was more of, I leaned towards cardiology more than any other specialty.
I love that. I'm sure you have a very similar story, Dr. Gashara.
True. I also grew up with the sciences.
Yes.
My mother was a nurse, so she inspired me into medicine. When I was small, I used to say I want to be a nurse, but I went a step further, became a doctor. I loved babies. So I went into pediatrics, and along the way, I worked with Dr. Betty Gikonyo. She actually inspired me into becoming a pediatric cardiologist.
I recently acquired her book. It is an amazing read. So yes, I understand why Dr. Gikonyo inspired you. So tell me some of the major causes of heart disease amongst children.
So amongst children, the major causes are those that children are born with. We have babies who are blue, and those are holes in the heart that blood mix.
Yes.
We have those who are having heart murmurs, and they actually have holes that do not mix. So we have those who are blue, we have those who are not.
Yes.
And the major ones will be holes that between the ventricles,
Yes.
between the auricles,
Yes.
between the major vessels. Some may be obstructing the blood within the major vessels. And then the blue ones where really blood mix. And they are called blue babies.
Okay.
Yes.
Okay. And is there anything as an expectant mother you can do to prevent any of these?
Usually, in most instances, I would say no.
Okay.
A few yes, because there are few drugs that may lead to congenital heart diseases.
Yes.
Yes. One of them also is alcohol.
Okay. Wacheni pombe. Especially while pregnant, wacheni pombe, number one. Number two, is it hereditary? If you have heart disease in your family, chances are you might have a baby born?
Yes, there's an extent of hereditary. You can have a family with children with heart diseases.
Okay. Tell me.
And also,
yes.
if you are a mother who have had a heart problem, you can also deliver a baby with a heart problem.
Okay. So the chances are pretty high about that. Dr. Nguchu, what about in adults? What are some of the causes of heart disease?
We classify the factors that lead to heart disease into two. They're
Yes.
the ones that you can't change, and they're the ones that you can change.
Okay.
The ones that you can't change are like age. As you grow older, your risk of heart disease goes up.
Yes.
Gender, it's higher in men the risk of heart disease is higher in men than in women.
Okay.
And of course, hereditary. So if anyone in your immediate family, your parents or your siblings has heart disease, your risk of getting heart disease is also there. However, the ones that can be changed are like diet.
Okay.
Avoiding highly processed foods, high salt diets, lifestyle. So avoid alcohol, smoking, exercise more.
Yes.
This sedentary lifestyle.
Yes.
Let go of it.
Yes.
Those are some of the factors that lead to heart disease.
Now, we've heard cardio. And cardiologist actually has the word cardio in it. So how important is movement and staying physically active and running and playing sport important when it comes to keeping your heart healthy?
It's very important.
Yes.
Primarily because your heart is actually the engine for the body. And if
Yes.
you don't exercise your engine, then it also tends to rust. But exercise also actually has beneficial effects across all organs, your muscles, your skeletal, your brain. So it's actually good for you across the board, not just in the heart.
On Double O Direct today, we are discussing heart disease. With September being Cardiac Awareness Month, we're talking about prevention, symptoms, and treatment. I'm joined by two phenomenal cardiologists. I have Dr. Nguchu, a physician cardiologist, and Dr. Gashara, a pediatric cardiologist. And you were telling me, doctor, that there's another symptom of cause of pediatric heart disease that you were mentioning, which is?
It is rheumatic heart disease.
Okay.
Rheumatic heart disease is an acquired heart disease. These are children who are born normal.
Yes.
It mostly occurs between 5 to 15 years. And how does it happen?
Yes.
This is a sore throat. We know most of the sore throats are actually from a virus, but this is a special bacterial sore throat. Occurs suddenly with fever, and the child is quite sick. So when you get that, don't ignore. Kindly take your child to hospital, because if the child is not treated, in about 10 days to 14 days, the child comes back now very sick with fever, unable to walk. And when that is happening, the heart is also having issues. So we say it also bites the heart. It damages the valves. If it continues and continues, this child will have very bad valves,
Yes.
does not grow, goes into heart failure. And eventually, it is an expensive procedure, because we might end up with valve being changed into artificial ones.
When you say the child is very sick, has a cough, so one of the symptoms is a cough and they must have a fever?
And it occurs suddenly, not the ones we keep sneezing, you're blowing your nose, you
Yes.
feel like your throat is itchy. This is a sudden illness. A child may go to school well.
Yes.
You are called by evening by the teacher, the child is very sick. So please don't tell them gargle salt.
Okay.
Take to hospital.
Fantastic. That is so good to know. You know, in my family, currently, we both have coughs. I was just negative my PCR for COVID, but my son has been coughing and a fever. I took him to the pediatrics at MP Shah. They checked him. He's fine. They said maybe he can even go to school. But, you know, I'm learning things every single day. Now, from an adult perspective, when it comes to the prevention of heart disease, what's some of the advice that you can give, Dr. Nguchu?
One is with regard to basically just change your lifestyle.
Yes.
Adopt a healthy lifestyle.
Yes.
Healthy diet.
Yes.
More fruits, vegetables, and nuts.
Yes.
Cut down on the starch and on the animal protein. We go to more of a plant-based diet.
Yes.
Exercise. Find whichever exercise you enjoy. There's no prescription. And basically stick to it. Try and maintain a normal weight and a healthy weight.
Yes.
Get at least a checkup once a year. Get a blood pressure check, get a blood sugar check, avoid alcohol, or at least cut down on alcohol. Stop smoking.
Okay.
It really is not
Helping you
helping
at all. Okay.
Yes.
So running your mouth, be knowing, Dr. Nguchu has not listed running your mouth as a form of exercise. Yeah. So all the talking you're doing is not actually helping you physically. Now, towards symptoms, what are some of the symptoms of heart disease in adults?
I would like to particularly address a very common problem we have
Yes.
in adults, especially in our setup. It's actually high blood pressure.
Okay.
It's a silent disease.
Yes.
It's a silent killer because you don't get symptoms. By the time you're getting symptoms from high blood pressure, things are very bad.
Okay.
But with regard to when you know that there's something wrong with your heart, you get fatigue, you get leg swelling, you get breathless,
Yes.
you can't lie flat, you start noticing that even you're bloated,
Yes.
your appetite goes down. Those are now we've reached the point where your heart has actually begun to fail.
Okay.
Yes, but way before that, even 10 years before that, something else was going on and you weren't paying attention.
All right.
So you need to get checked.
What about in children? You've mentioned the child being very sick, the child having a fever and a cough. What are some of the symptoms of, heart disease in children?
Children like playing.
Very much.
So when you see a child not playing or getting to the field, plays a little and comes out to rest back, there is a problem.
Okay.
Children, we get them into the house because of darkness.
Yes.
So when you see one who keeps in the house not wanting to play, something is not right. The other thing is they also sweat a lot. They don't gain weight. They breathe pretty fast, but they have no fever. The growth is not there. And for the small ones, they are not able to breastfeed well. They don't gain weight. They breastfeed a little, stop, try again. They never get full. They never gain weight. So when you see a baby not gaining weight, breathing fast, and sometimes you can even feel the heart beating pretty fast. Children, unless the bigger ones, may not have the swelling of legs like adults. But you feel the heart really moving fast or the eyes swell, then something is not right. Yes.
This is 00 Direct, female host, female artist, female guest. I'm dressed by the amazing Margaret, the label. And how are you doing? Is your heart damaged? Because if it is, I have two amazing women that can probably fix it, right? I have a pediatric cardiologist, Dr. Naomi Gashara, and I have a physician cardiologist, Dr. Karimi Nguchu. So we've talked about symptoms. We've talked about how to prevent getting, the ones that you can prevent getting heart disease. What about treatment? What treatment options are there for adults with regards to heart disease?
The treatment options range from conservative management, where for some patients you tell them just change your diet and your lifestyle and a few things in your life.
Yes.
To medication. There's a whole range of medication basically to treat and manage some of the conditions. And for some patients, we actually have to go for an intervention, either bypass or you have to get a pacemaker. We just have surgery done.
So with regards to prevention vis-a-vis treatment and cost, right? Which is the best bundle to have? Because you said, of course, age is a factor. Some, of course, are lifestyle related. So, change your bad habits, do not smoke, cut down on your animal protein, alcohol, etc. But with regards to the ones that you really cannot prevent, how do you manage those? And what do you actually tell your patients in a technical way? What are the terminologies?
You see, it will depend on what would be the best management platform for you.
Yes.
So for those in whom you actually need to use medication, you advise them about the medication. And for those in whom you actually need to do an intervention, whether surgical or minimally invasive, you will send them there.
Okay.
But in most cases, there's always an aspect of lifestyle, even for the hereditary ones.
Yes.
There's always an aspect of your lifestyle that you have to take into consideration.
When it comes to treatment, is there anything that is not available in Kenya that you're then forced to refer a patient outside of the country for? Costs not being a factor. What are treatment options that are not currently available in Kenya for adults?
We have improved in the recent years so that most of our options are actually available now. But those are based on patient-to-patient basis. So there's this patient whom you see and you can do the procedure, but you anticipate complications that you may not be able to handle.
Yes.
And those are the ones that you will refer out of the country.
All right.
Yes.
Dr. Gashara, when it comes to children with heart disease, what are the treatment options available?
There are many different options.
Yes.
Remember, for me, they are either congenital or acquired. I'll start with acquired.
Yes.
One is to treat the sore throat. If the sore throat is well managed, then you don't get into rheumatic heart disease.
Treating of sore throat, can we just talk about that? Because currently my son is on lemon ginger, honey and turmeric.
Yes.
And gummies, vitamin gummies. So how are we treating the sore throat? He's 4 years old.
I said the age is 5 to 15 years.
Okay.
We have a few below 5 years. But remember, most of the sore throats will still be from viruses. So that remedy will work.
Okay.
But the thing is immediate or sudden onset, very sick, and they cannot swallow.
Okay.
That is the key.
All right.
That one, don't give that remedy. Take to the doctor.
All right.
If it is well treated, then there will be no complications. If it's not well treated, then they'll come to us with heart disease. There are those who are not so bad, so we are able to maintain on medication and let them grow, because we don't want a small baby to have surgery. There are those who come very bad. We control them, and some intervention has to be done, which mostly is either surgery or pinhole. Pinhole we mean through the leg to the heart.
Oh my goodness.
Then there is congenital. Some, by grace of God, will be holes that will close by themselves. We don't need to do something. There are those that are also complicated. They need surgery. And like Dr. Guchu said, some we can handle here. But in pediatrics, when you have very complicated ones, unfortunately, we have no choice but to send out of the country until we reach that stage when we can handle them locally.
Okay. What about transplants in pediatrics? Is it an occurrence?
Not quite. And transplant is a whole topic by itself.
Yes.
We don't do in Kenya. And if you are to send out, they also have a very long queue waiting for transplant. So it becomes quite complicated.
And in adults, the topic of transplants?
It's the same problem.
Yes.
Because transplants, you also need to change a few laws in the country to
Okay.
allow you to actually harvest the hearts, cadaveric hearts. And it's very complicated. So for those patients you need to refer, you'll refer, but be aware that they'll have a very long waiting list.
Yes.
And even then now, we have what we call destination therapy. There are options so that the patient who would have qualified for a transplant can get an alternative that will actually sort them out until when they actually need the transplant.
Guchu, Dr. Gashara, we have a physician cardiologist and a pediatric cardiologist. And we're talking about the number of cardiologists actually in the country. You know, off mic, we were talking about the fact that demand is too great. Isn't that right, Dr. Guchu?
Yes, it is. Maybe for adult cardiologists, we may be about 40 to 50 in the country, but the number of patients are actually many and increasing.
Wow.
Yes, as we have an increase in cardiovascular diseases due to the changes in lifestyle and diet.
So lifestyle and diet are the key factors in our heart disease here in this country.
Specifically with regard to adults,
Yes.
in addition to all the other problems like the congenital and the acquired congenital, rheumatic heart disease.
Yes.
Now we are beginning to see more high blood pressure, more diabetes, more heart disease, basically related to that diet and lifestyle.
And of those 40, 50 cardiologists, adult cardiologists, how many of them are actually women?
I think we're less than 10.
Oh, okay. Looking to the future and the fact that some of our jobs are about to become obsolete, you need to be a specialist, especially if you're going into medicine. And as a woman, think cardiology. Now, with regards to pediatrics, right, maybe you can tell me about the number of pediatric cardiologists we have in the country.
Well, we are about 12 for a population of about 20 to 22 million, considering that 50% of the population is
Wait, you're
children.
telling me, Dr. Gashara, that there are 12, not women, in total?
In total, we're about 12.
Okay, where are we falling short here exactly? Is it in our training? What is the training currently like in this country for cardiologists?
Currently, we are just starting like local training. We've been going out of the country.
Okay.
I'm not sure why. It's probably not too popular, but it carries a lot of emotion. So most doctors will say, no, I can't handle this.
Wait. We are just starting pediatric cardiology training
Locally.
So where did you train, for example, Dr. Kashar?
I trained in India in a hospital called Madras Medical Mission.
And Dr. Nguchu?
I also trained in India, in Chennai.
Same hospital.
Because there's just no training facility available locally.
At the time for us, it was not available, but at least now we are beginning to see institutions waking up and starting to train. So like, for example, there's a training program running in Karen Hospital and another one running in Aga Khan Hospital, but they're relatively new, maybe about 2-3 years old.
Yes.
But at least in pediatric cardiology, I can see Dr. Gashara doing an excellent job in Kenyatta National Hospital.
Excellent. Now, is this as a result of that being the cost of treatment is very, very high? Because if there are only 12 pediatric cardiologists in the country and with such high demand, what are the costs with regards to treatment like, with regards to the ones you can treat?
Let me first say that the National Hospital Insurance Fund has really helped in terms of financing. And I would urge everyone to register, because in Kenyatta National Hospital, once you have that card, you are sorted out.
Okay. Okay.
Even when you are going outside the country,
Yes.
it caters like half of the cost, if not all.
Your NHIF card.
Your NHIF card.
Oh my goodness. Please get onto, is it eCitizen to register for NHIF?
Yes.
Yes.
Get your NHIF card because you can get treatment for heart disease at Kenyatta National Hospital with that card. And even if you want to go abroad, it caters to about half the cost. Isn't that
Yes.
right?
Yes.
So, ladies, before I let you go, please, some parting words. We'll start with adult heart disease. What can you tell me, Dr. Nguchu?
Prevention is key. Please get a checkup, maintain a good, healthy lifestyle, maintain and watch your diet.
I always say 00 fit at 41. Come and run with me, play sports with me, take a walk with me. I am willing to walk hand in hand with you to prevent heart disease. What about you, Dr. Gashara?
The congenital heart disease, we may not have a lot of control, but rheumatic heart disease we can prevent. So take your child who has a sore throat to hospital.
You heard it here. Thank you so much, doctors, for being on 00 Direct this Saturday. And